what got you started, sort of being interested in air quality as an area to sort of campaign on or work towards?
Yeah, so I mean, I'm interested in the wider kind of environmental impact of healthcare delivery, but also vice versa. How a healthy lifestyle and a healthy environment improves our health. So, the wider climate crisis and how we're contributing to that in healthcare, and also how it's affecting our health. And air pollution is, although obviously it's not the same as climate change, the root causes are the same. So I kind of consider it really, as part of the overall issues with our kind of, relationship with in the environment and the natural world. So in the work that I do within the hospital on green issues and within my professional organisation on green issues and air pollution, sort of it all kind of really links in, particularly in relation to stroke care and stroke incidents as well.
Yeah. And that sounds like a lot of conversations that I've been having over the last year or so while I've been at Gap as well, in terms of the links between what healthcare does, the pollution that generates, as
Yeah,
well as how we can decrease that, but also give people advice on how to have behavior changes which might actually improve their health long term.
yeah, exactly. And
Um,
I think that kind of we're very used to seeing air pollution discussed in the context of child health and respiratory health, but actually I think it's really less well known about the impacts on, wider health, cardiovascular health, and also with my background in geriatric medicine as well, the fact that older people are particularly vulnerable to the health impacts of air pollution. And I
yep.
just don't think that's well recognised and therefore not well addressed at the moment.
Yeah, and I guess why commonly come up against as well is that people obviously make the connection between respiratory health and air pollution,
Yeah,
but it's actually the cardiovascular, so heart issues and stroke issues and things like that, which actually cause a lot of the sort of mortality, as from air pollution. So yeah, it's great that you're making strides really in that direction, essentially. And yeah, just coming on to what you did recently, you had this amazing cycle from Brighton all the way to Liverpool, wasn't it? And that was in November.
yeah, that's right. I'm a sustainability lead for the kind of professional body for stroke medicine, which is the British and Irish Association of Stroke Physicians. And the kind of National Stroke Conference, the UK Stroke Forum, was taking place in Liverpool this year. So, as sort of in my role as sustainability lead and to kind of highlight the issues around air pollution, I decided to cycle to the conference and kind of really use it as a way to get people talking about the effects of air pollution, but also to think about, how we travel in our day-to-day lives, the benefits of active transport, and then how all that links in with our professional lives as well, and what we're trying to do with kind of wider public health and stroke prevention.
Yeah, and it really feels like a lot of the solutions are the same in some senses for like climate and air pollution and general health, fitness, that can, active travel really ties a lot of those together. So it was a really powerful message to send as well. And how long does that take you? Must have been a few days at least.
Yeah, no, so I did it over 4 days. And yeah, I kind of naively took Google Maps at face value in terms of the number of hours it was going to take me each day, which, yeah, I will know not to do that next time, because it essentially took quite a lot longer by the time I'd navigated the routes, dealt with punctures,
Yep.
um, yeah, dealt with kind of being on my own in very muddy conditions and things. But I mean, I did manage to do it in the 4 days, but it did feel like it was quite a trial. I did reflect actually as well, because I was part of doing it was to highlight the importance of active transport, as for prevention of chronic health conditions, but also for mental well-being. But I think that there's a lot to be said as well about the cycling infrastructure and how well that's set up in this country. And actually, I was pleasantly surprised at the number of this kind of off-road cycle paths and things that were available. And I think that's really important that we include sort of cycling infrastructure in our plans to reduce air pollution.
Yeah,